Today, we talk about...
Again, we can talk about genetics. Right. What causes? If your dad's got gyno, you're going to get gyno. If your uncle has gyno, you're going to get gyno. Right. If your mom, no, it doesn't.
If mom's got tits, you're
gonna get tits. No, it's not that. Right. And I got guys who say, listen, I got two brothers, they got nothing, and I got these big tits.
Right. Well, sometimes it's because, like you said, it could be maybe they were overweight at a time, or they're taking hormones, or things like that. I want to show you. So, you must have names at this point for like different versions.
Yeah.
You know how like Trump has like names for all the people that he dislikes and like he thinks he's hilarious. Like you must have like these like quirky names for like different forms of gyno. So I'm going to show you. So we have over here David Hasselhoff. So this is Dave's. So what would you call his kind of gyno?
Pseudo-gyno.
That's pseudo-gyno. Okay.
Pseudo-gyno. But I don't know what Dave takes.
But you don't know. I mean, these look pretty giant, Doc. I don't know. But you think this is just saggy because he's older?
Saggy. It's skin. It's fat, and there's glands in there.
This has gotta be fun.
But David said, in his Baywatch days, he was pretty fit there. And now
he was a good body. I mean, he had a good body.
Now, did he take stuff? Did he? Did he take stuff?
Who knows?
Who knows?
You know what's funny? And you say like he wasn't such a big guy back then. He was just very cut. But you don't know what people are taking these days. Like,
what's his name? What's that bodybuilder guy? Skywalker.
Which one?
Skywalker is
that's Schwarzenegger. But Skywalker is Star Wars.
No, there's a bodybuilder.
Oh, really? I don't know then. I would know this.
I don't know.
Okay, but so what about him?
Well, Schwarzenegger took it, but it was different back then. But then again, he had open heart surgery because he messed up his valves.
So someone told me, so I'm being in the bodybuilding world, and they said that back then, and I believe it to be true, they didn't take as much stuff as people think they did, and now
they didn't, right?
But here's the reason why: is because everything was pharmaceutical back then,
right?
And it was legal, so you can go to your doctor and say, "Doc, hint, hint, I want this for this," and they just write prescriptions. Nowadays, it's all underground labs, so you're kind of like it's maybe not as powerful. So people think like if I took 5,000 milligrams of something, I got to take 2 grams of it now.
Well, you know what Tren was originally for?
So Trenbolone, just so everyone doesn't know, Trenbolone acetate is a form of anabolic steroids that was actually what was it used for?
For animals?
Cattle, yeah.
Yeah.
It was put muscle on livestock.
Yeah.
And then it was actually made. It was a pellet you'd put in a cow, I think.
Right.
And then they found a way to like melt the pellet down, suspend it in oil, and they just started injecting it to people. But when I say they, I mean like bodybuilders, not doctors.
Right.
And they're like, okay, I guess no one died yet. So, and the thing about Trenbolone, why it became so popular in the bodybuilding community, is because it makes you very big, but it also makes you very defined.
Yep.
At the same time,
and they'll get this Tren sweats, I think.
The problem is it's one of the most powerful steroids out there, and the problem with it is that every negative mental side effect you get from steroids is probably from this drug. Yeah. Aggression, mood swings, anger, and you also get gyno. You get the type that Doc, do you know the difference between the progesterone gyno, like the gyno that has like the where you lactate and stuff?
Yeah.
So a lot of that I feel like comes from that because like people who are on it like start lactating and why does that happen, by the way? Because by the way, I'll tell you a personal story in a second, but I lactate out of my nipples. Not a lot, but like if I squeeze it very hard, a drop comes out and it's white or sometimes it's brown.
Can you be milked?
Yeah.
Yeah.
By the way,
Greg, can you milk me?
Yeah. Well, the coffee that you just had, I hate to tell you, but that's homebrew. But yeah, no. So what? Like, just for people who don't know, do you know what that is? Like, what's the deal with why do some people lactate and some people don't? And
well, their prolactin level might be high and screwed up and stuff. And that, number one, if you have that, maybe you should get an MRI of your brain. Make sure you don't have a pituitary.
If you're not taking steroids,
right? But it just enlarges everything, so you get the milk ducts that are start to function.
Right. Well, now on to the next one. We have here Jack Nicholson.
Jack.
What would you call this?
Jack. Same thing. Old man boobs.
This is old man boobs. So you would say it would be more saggy. It's less
but
tissue.
the most important thing is look at the chick that he's with. So
right. So her gyno is pretty bad. You're saying
right? No.
Right.
He's Jack is again he's what is he 70s at least?
Yeah, I mean he's up there, right? I mean,
right.
And again another guy who was very skinny and he was very fit back in his day. I mean Jack was. I mean, he was like a ladies' man, but when I look at this, I'm like, this looks like a pair of tits on him. I mean,
yeah, but something. If you're in a freaking yacht in Monte Carlo,
like what you said earlier,
who the fuck cares?
Gotta own it, have confidence.
Tits.
He's with a girl that's old enough to be his granddaughter. I think he's good.
He's on some kind of yacht in Monte Carlo,
and I guarantee it's not his granddaughter.
Right.
And the thing about it is that is the face you make when you don't give a fuck that this is what's going on down here.
You don't.
Yeah, I would do the same.
Yeah. You're looking at the cameraman saying, leave me the fuck alone.
You're just like, whatever. This is not actually so bad. This is Simon Cowell.
Yep.
What would you call this?
Well, I mean, again, his posture is bad.
Okay.
He's just he's got little shit dogs, but his posture's bad.
Yeah.
I mean, this is probably he's got gyno in there,
Right.
and at that age you need to tighten up the skin, heat up the skin. But he's not that bad for a guy that's that his age, and
he looks like he's in overall good shape. But
he's in overall good shape.
But if you really examine the chest area, and again, you're someone who's very tuned into it because you do this for a living, there's definitely maybe something in there, or maybe some tightness that could be done. You're saying
amazing, yeah. No, he needs, but he just can't have gland. He's the type of person who says, "Oh, can you just remove the gland?" No, you need to define the edges of the muscle. Again, it's all smoke and mirrors. It's all shadows. Positive spaces and negative spaces. That's why you want to do decline bench presses or incline. So
if you want to do what? So if you want
upper,
you want to
back.
go incline, and you want to squeeze on the incline. That's why again, when I work out with my clients who do have gyno, they usually feel really good, at least within a few months, when they start developing the upper. Because when they have a t-shirt on, even if there's a little saggy in the t-shirt, you see this kind of definition.
Right.
And even, by the way, even if it comes out, like that's, I'm sure you know, there's people when you've taken glands out, and like, well, now I kind of feel like concave a little. To explain to them, like, no, now you have to work out.
You have to work out.
Right, you have to actually build muscle. He's like, I did some of the work, but you got to do.
Right. It's like almost like if you like a rock in soil, you take off the rock, you get that big indentation.
Right.
But now people are actually putting fat, like Brazilian butt lifts. They lipo and put fat in the ass. Now they're putting fat in the pecs.
In the pecs.
You can put fat in the delts. You can put fat in the biceps.
Oh,
you
wow.
can etch your belly and do fat in the six pack.
I'm very good at putting fat in my stomach.
No.
I do that very well. So here we have this. You know him as Ice-T, and we have Ice-T. What would you call these tits?
Sweet iced tea.
Call them sweet.
Sweet tea.
Call them iced teas.
Sweet.
I mean, these look like gyno. This looks like. I mean, he's obviously a little heavier than he used to be. Because I don't know if he was ever skinny, but he looks to be a little heavy on the heavy side. So maybe he needs to lose weight.
He's bending over a little bit.
Right. So you're saying some of this is postural. So do you think sometimes when people stand up?
I mean, these are like little puff titties.
Right. When you examine someone, do you examine them sitting down and standing up, or just one or the other?
No, I have them hunch over because they'll frequently hunch over and take their fingers and kind of flip their nips there.
They're probably so used to doing it themselves
right.
I gotcha. This is a really bad one. And again, it's always these people that were such sex symbols because they probably give a shit the least about this stuff. This is what's his name? Steven Tyler. And he looks like if I saw that on a woman. I mean, these are tits. I mean, these are boobs. And again, he's a skinny guy. I mean, again, he's pretty fit. I can almost see his six pack. I could see the definition of his arms.
His arms are pretty skinny, but I mean, he's not a bodybuilding guy.
Yeah, I was going to say. So is that also pseudo? Or?
Yeah, this is pseudo.
Okay.
This is pseudo. I mean, everybody's got gland, but when you get older, Tyler's what? He's again in his 60s. Your testosterone level drops, and you don't have that bombardment of testosterone in your system, so the glands are going to be more fatty than true hard.
So that's what makes it pseudo, is when it's not really about glandular
pseudo means
tissue.
false.
Right. So it's more so just the skin and
it's skin and fat. There's some gland in here. You also have to explore the gland. But you're showing me older guys.
Well, we got someone.
Yeah, show me the.
So he's not that old. I mean, maybe he is. He just looks really young. But Denzel, we have here, and again, he's not so bad. But you can see through the t-shirt. What would you call that? I mean, this looks like maybe a case that you probably see very commonly. No.
I mean, this is something that I got, and I want to get it done.
Yeah, I was going to say.
So I actually,
if you didn't mention whatever topic we were talking about,
I
would look at that and be like, that looks normal to me.
On my YouTube channels, patients of mine comment, doctor, 1 minute 10 seconds, you got gyno. When are you going to do it? With a big smile face, and I says, I know, and I'm going to have it done.
Right.
I mean, I wake up every morning, and I'm trying to make these people great. And listen, I'm 63, and I got gyno. And you know something? Damn it, it bothers me every fucking day, and I'm going to have it done.
Well, I know someone really good.
No, I know two. There would be two people that I would go to.
So it's interesting, and I didn't know if you want to talk about it, but we had spoken about this where interestingly enough, I know a lot of surgeons, plastic surgeons. You go to their office, and it's like, wait a minute, like you're telling me that I got to get this fixed over here, and you look like
right.
It's like, what's going on? But you actually, you're someone that you practice what you preach. You also feel like you as you've gotten older, you wanted to do something.
Right. I try to eat right. I exercise. If you go on my Instagram, I do hot yoga all the time. I mean, damn, I just had a hamburger next door, which is probably the first hamburger I had in 6 months.
But look, you're probably in great shape for your age, but you're not 20. And
I'm not 20.
And when you were 20, you probably didn't have an issue at all.
I didn't have an issue, or it didn't bother me back in the in the 70s.
Do you feel like seeing all the cases that you've seen, has that made you think about it more than?
Oh yeah, no,
really?
I want to definitely have it done.
Right, because I'd imagine just doing it to so many people through like day in and day out, you're probably like you maybe think that even if you had like a 1% issue, that it's something where you want to just get it done. It's like almost like giving someone like people the sickest haircut every day, but your hair is just growing out.
I mean, listen. The bottom line is you want to look good, you want to feel good, you want to look good. Now, some people don't. Some people, some
just don't care. Yeah.
They don't care, and they're happy internal. And it's great if they really don't care. Right. They're and it doesn't bother them. Well, God bless them. It's great. But then there's guys. I'm included, one of them. I'm brushing my teeth. I look in the mirror and I go, oh, crumb. I got these nipples that are down by my belly button. It's like, and if it bothers you enough, and it's tormented enough, and you got to pick out your T-shirts. You got to pick out your clothes. I've got a son who went to University of Miami, and it's the U. So they get big ass T-shirt with the tip of the U is at both of my nipples, and I go, oh man,
It's things like that you don't consider until
until I was at the bookstore at the University of Miami, put on a University of Miami T-shirt with the U on it, and I says, I ain't buying this.
Well, how about a bra? With that,
a bro.
Yeah, a bra.
A man's ear.
Yeah, with that.
A Seinfeld.